introduction of technology into the healthcare sphere has a possibility to create a multitude of benefits to both patients and physicians. Electronic health records, otherwise known as EHRs, represent a powerful shift in the way that health institutions interact with patient information. As the health industry modernizes, it seems only natural that it transitions from the use of paper documents to saving data in online databases. EHRs have the ability to both lower healthcare costs and create a more consistent quality of care. Furthermore, patient care could be further improved by updating computer physician order entry systems, or CPOEs, systems that are designed to send alerts of potentially harmful drug orders or prescribed to patients. Together, these advancements may have profound impacts on people's lives.
There are a few ways in which EHR is beneficial and advantageous. Some examples of ways EHR can be helpful, according to the article, include allowing an administrator to obtain patients' data for billing, physician to view trends in the effectiveness of treatments, a nurse to report significant problems, and a researcher to analyze the performance of patients with comorbidities. In addition, EHR could resolve vocabulary variations that make it difficult to find or track cases across multiple users. A structured vocabulary system must be implemented that includes data structured so that the system can recognize appropriate terms and place them in the proper context. Other features that come to my mind that make EHR beneficial include enabling quick access to patient records for more efficient care, sharing electronic information with patients and other clinicians, allowing for safer and more reliable prescribing, helping providers more effectively diagnose patients, reducing medical errors, reducing costs through less paperwork, enforcing privacy and security of patient data, and providing safer, more convenient care. EHR has made a significant difference for healthcare services and will continue to advance to create an even greater successful healthcare experience for both patients and healthcare providers.
So long-term preservation and storage of records. We all know how important our health data is, and it is important that we have access to this type of data in the future. So it's essential we have a system to preserve these logs. And before constructing a system to store long-term EHR, we need to decide who will have access to this type of data. So it's important that patients have their privacy, and the storage will be decided on state regulations. This is because the data for a patient lasts about 20 to 100 years. And the most important type of data is used in big services like labs, pharmacy, and radiology. And the most essential components include registration, admissions, discharge, and transfer. This includes patients' important information, which is used in clinical analysis and research. And other components include like radiology components, which are used in radiology departments, which include patient tracking info, scheduling, image, and tracking functions. And other components include like laboratory system components, which are like standalone systems and are focused on implementing orders, results, and billing and other like administrative information. And we have pharmacy system components that are in large hospitals where like robots fill in prescriptions, but like 31% of those electronic health records are like entered in again in the pharmacy system.
Computerized physician order entry systems are used by most physicians today to enter instructions for treatment for patients under their care. Based on the 2015 hospital survey, CPOE systems failed to send alerts for 39% of potentially harmful drug orders and 13% of potentially fatal orders. So this is certainly a software issue. However, a matter to think about is, do doctors even look at or consider the alerts prompted by the CPOEs? The answer is most likely no. Potential reasons for that might be, one, alert fatigue, which means that if a system shows too many pop-up alerts, doctors might have a tendency to just ignore it and close the error or close like the dialog box. So this might take some design thinking to better design the CPOEs such that errors in the medications are highlighted like early on as they're trying to make their prescription instead of showing a pop-up box, because that can be annoying. A second reason might be that doctors think that they know the patient better than the system because they're the doctor and they're looking at the patient at the moment, which is a decent enough decision-making factor. So Leapfrog's suggestion to have patient treatment orders be double and triple checked can prove to be a good way to deal with the issue of CPOE alerts being ignored.
According to a Caslight Health analysis of data from the Leapfrog Group's national hospital study, computerized physician audit entry systems, or CPOEs for short, failed to send alerts for 39% of potentially harmful drug orders in 2015. In addition to that, they also missed around 13% of potentially fatal medication orders. Because the Leapfrog group worked to remedy this situation by talking with hospitals and working with them. Now, 96% of all US hospitals meet Leapfrog's standards for CPOE implementation, and that includes like things such as adding new treatment and guidelines to the CPOE software, and adding new medication and being aware of the way different medications and newer medications interact